Hello, this is Tank 22's Donor Anatomic Record Project, and the people in Tank 22 was Alyssa Cruz, Hannah Dakin, Stanley Fuentes, and Casey Spinelli. So here's a brief outline of what our presentation will be like today. We're going to give you a brief introduction to our first patient. We're going to talk about anatomic variations we found during our dissection. There weren't many, but we'll talk about a couple. We'll talk about abnormal tissues that can be identified. Talk about Parkinson's disease, which is the cause of death or on the certificate of our patient. We'll talk about suspected cause of death, some summary, and then you'll see our references. So here's our first patient. She was female, Caucasian, 72 years old at the time of death. Her profession was a teacher, and the cause of death listed was Parkinson's disease. And it's not really a normal list as a cause of death, but we'll just talk about a couple of different ways that we were able to observe Parkinson's disease and some of the other things that we think could have caused Parkinson's or her death. So here's some anatomic variations. So normally in Parkinson's disease, one of the main things that you'll see is deterioration of the substantia nigra, which is an area in the midbrain. And as you can see over here, the substantia nigra is well named. It's literally black pigment. But in Parkinson's disease, this area will deteriorate, and eventually there will be no pigment at all. So overall, our cadaver displayed very little anatomic variation from what is considered normal. Everything looked checked out. We didn't notice any heart problems. We didn't notice any liver. We didn't notice any issues at all in her abdomen. The one thing that we did notice, though, is that overall her skeletal muscles were pretty atrophied. They were really, really small, really hard to kind of dissect properly without destroying them. So we attribute this loss of muscle mass and just overall low skeletal muscle to be a probable reduction in her we attribute this to being a probable cause of her death because muscle mass is a great uh, indicator of that. And so we also observed deterioration of the dopaminergic neurons in her substantia nigra, as I was talking about earlier with this black pigment. And as you can see in this example, this is an actual Parkinson's patient. And this is kind of exactly what our patient looked like. So in our patient's midbrain, there was no black pigment whatsoever, which is characteristic of Parkinson's disease. And this is believed to be the pathological process of Parkinson's. On a histological level or on a microscopic level, in Parkinson's disease, there's usually a large amount of Lewy body deposits. And so Lewy bodies are just a protein aggregate. And so as you can see over here on this left figure, there's lots of these little deposits. And on the right side of the non-pathological figure, you can see that there's fewer deposits, for lack of a better way of explaining it. But basically, they're very common, found in Parkinson's patients. They are associated with dementia and memory loss, but they can only be seen microscopically. So that's a really cool way that we were able to tie in our anatomy experience with cell biology this semester. And just kind of histologically, for your information, they are accumulations of the protein alpha-synuclein. So it's pretty cool. Switch.
So like we said before, our patient's cause of death is listed as Parkinson's disease on her death certificate. And Parkinson's disease is not really a cause of death, but it's a degenerative disease of the central nervous system that affects motor function. This has to do with the fact that the neurons in the substantia nigra that Alyssa was talking about release dopamine, which plays an important role in motor function. So usually when a patient is first starting to show the symptoms of Parkinson's disease, it starts with a slow tremor of the hand at rest. And this tremor in the early stages is stopped when the patient starts to use their hand or is in a deep sleep. The early stages show 4 key symptoms: a tremor, bradykinesia, which is a slowness of movement, rigidity, and instability when they're of their posture when they're sitting or standing. Advanced stages of Parkinson's disease also show autonomic dysfunction, psychiatric problems like dementia, depression, and altered sense of smell and sleeping difficulties. And some of these are just a result of being sick for so long, and some of them are a result of the neurons that are affected by Parkinson's disease. Um, Although we don't know if our patient underwent any treatment for her disease, there are some treatments that are available that help make a patient with Parkinson's disease live a more full life, although the damage is irreversible. The first treatment for Parkinson's disease is L-DOPA, and this is an anti-Parkinson medication that is able to cross the blood-brain barrier. So, like I said before, the neurons that are degenerating are responsible for releasing dopamine, and so that's where most of the symptoms come from. So, with this drug, it's able to cross the blood-brain barrier and so alleviate some of those symptoms from the lack of dopamine. Dopamine agonists are useful for that same reason. And then anti-tremor medications, canes, walking devices, those sorts of things help make their function easier on a day-to-day basis. And deep brain stimulation is a newer method that they're using to try to treat Parkinson's. So, like I said before, the death certificate of our cadaver listed Parkinson's as the cause of death. We found this quote that we thought was really nice that says that you die with Parkinson's disease, not from it. So, we don't think that Parkinson's disease actually killed our patient. As Alyssa was saying before, we didn't really notice any gross anatomical variations that could explain her death. But we found that falls and pneumonia are common complications of Parkinson's disease that can result in death. So it seems most likely to us that the ultimate cause of our first patient's death was either a fall or pneumonia as a complication of her Parkinson's disease. So in summary, we did observe some gross anatomic variations, including significant muscle atrophy and degeneration of the neurons in the substantia nigra. Histologically, like Alyssa said, we didn't actually collect a sample from our patient's substantia nigra, but it would be expected that they would show Lewy bodies or those deposits of protein in the tissue obtained from the substantia nigra. And the only condition our cadaver is known to have suffered from is Parkinson's disease, but we believe that it was complications from the disease that actually led to her death. And these are the references that we use for our research about Parkinson's disease, as well as the substantia nigra and the other anatomical and histological things that we discussed.